to continue with our discussions about aerobic non-swarming bacteria. When you say aerobic non-swarming bacteria, aerobic meaning these are bacteria that needs oxygen, and non-spore forming bacteria, these are bacteria that has no spores or does not possess spores. So we have the gram-positive bacilli, the Corynebacterium, Listeria, Erysipelotrix, Nocardia, and other related pathogens. So Corynebacterium, usually the shape of that one is considered to be club shape. And we have the, or known as coryneiform or dipteroid bacteria. So based on that different organisms of Corynebacterium, we have Corynebacterium diphtheri, the one that is toxigenic. When you say toxigenic, these are bacteria that can cause toxin or it has a toxigenic strain, diphtheria. So usually based on the general characteristic club shape, metachromatic granules, wherein the granules looks like pink, and black colonies in tellurite media. So non-toxigenic strain are, it can cause bacteremia and even endocarditis. Another one is the ulcerans, grayish white colonies, urease positive. When you say urease positive, it can convert urea into carbon dioxide and ammonia. And of course, it causes diphtheria, toxigenic strain man siya. And then we have Corynebacterium pseudo tuberculosis. Pseudo means false. So based on the general characteristic yellowish white colonies, urease positive and toxigenic strain may cause diphtheria, and it is also considered to be nosocomial or hospital-acquired infection, especially lower respiratory tract. And we have the striatum, so wala siyang general characteristic, while urelaticum produces urea, and it is considered to be multi-drug resistant, so it can cause cystitis and pyelitis. So pyelitis, that is inflammation of the pelvis or renal pelvis. And we have Corynebacterium jejunum, so grayish white colonies, multi-drug resistant. Usually it can cause bacteremia and other infections in immunocompromised patients. So when you say immunocompromised patients, these are patients that has already lower immune system. So treatment, so pwede yung diphtheria toxoids. Usually this is commonly used with tetanus toxoid or the acellular pertussis vaccine or DAPT as a single injections to be used immunization of children. So pwede 3 doses in the first year of life, 15 to 18 months. So and then we have the 46 years old of age. So pwede tayo makahatag ng diphtheria toxoid vaccine. So treatment, so if there is what we call infection caused by Corynebacterium, erythromycin or penicillin for 14 days. FOS treatment cultures to confirm eradication. So meaning, based on the cultures, kasi kung ano specimen, the patient is, there will be specimen sample or tissue sample coming from the patient also. And then it will be examined under culture, and then to distinguish what is really if for confirmatory, I mean kung Corynebacterium diphtheria gid siya. So based on the characteristic, so kung i-culture siya, examine under microscope, it should be club shape. Usually there is what we call a sample that is taken up in the mouth or oral cavity. Pwede yung swabbing, I mean. Next, Listeria monocytogenes. So this is a short, Listeria monocytogenes, gram-positive non-spore forming rod. So catalase positive. When you say catalase, is an enzyme that will convert the hydrogen peroxide to water and oxygen. So 2 forms of prenatal listeriosis. So Listeria monocytogenes is a causative agent of listeriosis. So early onset of syndrome is granulomatosis infans dyspeptica. So disease characterized by neonatal sepsis. So may mga postular lesions, granulomas containing the Listeria monocytogenes of multiple organs. So death may occur before or after the delivery. Usually that is already, the infants are already infected. Okay? Or the baby. So the late onset syndrome causes by development of meningitis between birth and the 3rd week of life. It is often 8 weeks. So usually, kung ano siyang bata, no, late onset syndrome. So pwede na yung yung ma-infect siya after the birth na. Okay? So it is usually happen if there is poor sanitation of the hospitals, okay, or hospitals that is contaminated by Listeria monocytogenes. So Erysipelotrix rugiopatiae, so this one is a gram-positive bacillus that produces small transparent glistening colonies, okay, acquired direct inoculation from contaminated source, samples ng mga fish. Usually it will form erysipeloid or nodular type of cellulitis. Yan. So this is considered erysipeloid. So ang yung treatment, you can give penicillin to treat erysipeloid. Next, nocardia. So appears filamentous, hyphae branching. So may mga appendages yung physical structure ng bacteria. So incubation period is 35 to 37 degrees for several days. Develop hip regular waxy colonies. Okay? The treatment of choice is trimethoprim sulfamethoxazole. If the patient fails to respond, number of antibiotics such as amikacin, amipinem, meropenem, fluoroquinolones, minocycline, linezolid, insupotaxims are used. So kung hindi naging mag-response ang trimethoprim, so these are drugs that are or alternative drugs given to the patient also.